Thank you, Mr. Chairman. I want to thank everyone for being here today as well. In rural areas like New Mexico, primary care providers serve as vital lifelines for all healthcare needs. That's why the Project ECHO model, which was developed at the University of New Mexico by Dr. Sanjeev Arora, is so critical. Dr. Herbert, Project ECHO, as you know from the University of New England, Maine's own effort, is a telementoring model that gives healthcare providers access to the tools and mentoring they need to treat complex medical cases. Project ECHO was found to be effective at equipping primary rural providers to screen for skin cancer when patients don't have access to dermatologists. That's just one example. Dr. Herbert, as we work to address the shortage of healthcare providers in rural areas, how can we better utilize and innovate models like Project ECHO to expand access to life-saving medical care?
Excellent question. Thank you very much. And we do have a Project ECHO project at our university as well. So I appreciate the question. I think it touches on a number of issues. First of all, the importance of prevention that we were just talking about, early assessment and intervention of problems, training primary care professionals to stretch their scope of practice. So earlier today we were talking about scope of practice laws that are overly limiting in terms of what primary care can do. So universities have a role in making sure, not just in training new students, but in providing continuing education and professional development for existing providers, using tools like Project ECHO, but also other kinds of continuing education tools to make sure that our primary care workers, physicians and others are equipped to address a broader range of concerns, because there's no way in a rural state we're going to be able to place highly trained specialists of every kind in every community.
I appreciate that very much. And Mr. Chairman, what we've already seen and witnessed, the benefits of ECHO models for health delivery, we're starting to see more and more benefit for educational opportunities as well with that ECHO model. So I'm hoping that we'll see expansion. Dr. Hildreth, this will be for you, sir. Despite the growing need for behavioral health services, the behavioral health workforce has unfortunately been hemorrhaging workers. More than 122 million Americans and 65% of New Mexicans live in areas with mental health professional shortages. While training and education are critical to build on behavioral health workforce, I want to focus on keeping the providers we have. Dr. Hildreth, how would dedicated retention efforts for behavioral health workers impact this vital workforce?
I think the retention is a really important part of our strategy, but I would also say that giving more training in behavioral health to primary care physicians who are at the front lines of this, we're not going to be able to train enough psychiatrists to solve this problem. But by bolstering the training of primary care doctors in behavioral health, that's going to be a big part of the solution. And again, one of the things I worry about is they play such an important role in our healthcare system, but they're, to me, underpaid for what they do, because they're the front line in bringing down the costs. Because if you can catch someone early with a chronic disease and get them into care, that's going to reduce the long-term cost to the country. So I would just suggest that training primary care doctors in behavioral health has to be a part of the solution. Thank you.
I very much appreciate that, Doctor. Thank you. Dr. Swanee, how can we explore promoting utilization of services to include midwife expansion and benefits? I've been a big proponent and having to explain to so many that the services that midwives provide is not just delivering babies. To many communities, this is the only care that they have, and they're the primary care providers in the area. So in that respect, how can we explore promoting utilization of these services to not only support these families, but strengthen the healthcare workforce as well?
Thank you. Yes, nurse midwives provide really vital care, throughout the postpartum period, prepartum, and during. And they work often with doulas, and I think there's been a lot of emphasis today about rural areas, and I think that focusing also on the infrastructure we do have in rural areas, like postal workers, like daycare centers, like Meals on Wheels, that we've got a lot of infrastructure we can take advantage of for the health of the nation. But back to the midwives, they're just really essential components, often underlooked, and can provide really comprehensive, tailored care.
I appreciate that response. And Mr. Chairman, in my closing time, Senator Murkowski was asking some questions around EMS providers as well, which I very much appreciate the attention there. As some of you may know, I survived a stroke a year ago. My sister, who took me to the hospital from a rural community, 30 minutes or so away from Santa Fe, to where I live, had the foresight to stop at a local fire department because they were washing vehicles as she was passing by. That was 5 minutes from my home. Those EMS providers provided incredible care to me, immediately being able to provide stabilization, and I know communicating with that emergency room before I arrived. Had it not been for them, I don't know that I would be here today. So I hope that we will see more support and attention with this kind of service, and especially acknowledging some local governments and communities across the country, their budgets don't allow for that kind of investment. So I thank you for that as well.
Well, thank you, Senator. And I did mention that in my opening remarks, and we're going to get back to that. Senator Cassidy